Hi, hello, everybody. Welcome to another episode of Reset Your Mental Health Online. Tonight we feature my cousin, the wonderful Dr. Christopher Brown, representing North Carolina, but Ohio as well. So I'm excited to talk with him. If this is your first time tuning in, Reset Your Mental Health Online is a mental health initiative that I started this month actually, just to help those who may be struggling with mental health issues, need support, encouragement, who need love, who need therapy resources. I'm not the expert, but I'm bringing experts in to help those who may need help. So, my cousin, who is a doctor, is going to speak on how mental health affects your entire body. Even though he is a nephrologist and does a million things that he's all going to talk about tonight. But Research Your Mental Health Online, like I said, is a mental health initiative. So we're online, we're on Facebook, we're on Instagram. And so if you've never heard of us before, if you're just now tuning in, if you're here to support Chris, this is what Reset is. R means for realign, E means to examine, S means to share, E, explore, and you all have to reset your mental health within time. So we're going to get right into it. I'm going to tell you about who Chris is, and then we're going to get started. So Dr. Brown is a native of North Carolina. Yay! Who graduated from North Carolina A&T State University with a degree in biology education. He entered into the University of North Carolina at Chapel Hill School of Medicine and graduated with a dual degree of Doctor of Medicine and Master's in Public Health with a concentration in healthcare and prevention. He moved to Ohio to train at the Ohio State University Wexner Medical Center in internal medicine and then completed subspecialty training in nephrology. He was on staff as an assistant professor of medicine at Ohio State University Wexner Medical Center, where he also served as an assistant medical director for the internal medicine residency program. Since that time, he has worked with a variety of settings, from large hospitals in Columbus to small critical access care hospitals in the rural areas in the central Ohio region as a hospitalist and a nephrologist. His past leadership positions include serving as a medical director for hospitalist service as well for community mental health facility. He has a long history of passion for being active in community and has participated in a number of community talks as well as giving lectures about kidney disease. He is a board certified doctor in internal medicine and nephrology. So we welcome my cousin, Dr. Christopher Brown.
Thank you. Thank you. Thank
So
you.
representing Ohio State tonight, we're both wearing red. How funny is that? So, Chris, can you tell us more about what your profession is as a nephrologist? What is that? Some people are like a nephrologist.
Right.
What exactly do you do?
Okay. Excellent question. I get that question all the time. A nephrologist is a doctor who that specializes in kidney disease and hypertension.
Ooh.
Yeah. It comes from the nephrons, which are part of the kidneys. But yeah, that's what the name means. If you ever hear that term, a lot of times when I'm telling people, I just say I'm a kidney doctor or hypertension specialist.
Okay.
So that's exactly what that is. So we do, like I said, primarily kidney disease. Like if a person has electrolytes, like, your sodium or your potassium is off and stuff of that nature, we take care of that as well. And then, of course, if the kidney function is going down, and like I said, we try to figure out what is causing the kidney function to go down. And of course, if that kidney completely fails, then we manage them on dialysis, or if they get a transplant, we help manage the kidney transplant as well.
Wow. Very good. Thank you. So with you being a doctor, you see people with the variety of ages, I'm assuming. So how do you as a doctor maintain balance and practice self-care when you are overwhelmed with the responsibilities of your profession?
Ooh, that's an even better question. So yeah, so I so yeah, so the field of medicine in general is of course quite demanding. Of course, most people know that. I've served in two capacities that kind of accelerate that. I mean, the hospital medicine that I used to do, is where you're focused strictly on patients that are inside the hospital. So it's not even outpatient stuff. And so some of that would be the critical care locations. So those, of course, create quite a bit of stress. Sometimes you'd work, typically you'd work 7 days and be off 7 days. But if it was short staffed, a lot of times you're not working more than 7 days. The days are supposed to be 12 hours. Of course, sometimes they get sometimes a little shorter, sometimes a little longer. And so, like I said, it does build up a lot of stress. The nephrology has been a little different because nephrology, when you go into that aspect, this is you do hospital work, you do outpatient, which is the regular clinic. So when you go into the regular clinic, and then we also manage the dialysis population. So that's where the people go into a dialysis center, get the dialysis, or they do dialysis at home, but we have to see and help manage that. So that has been a little bit different. In terms of managing the stress of that, of course, over time, you learn like multiple coping mechanisms. Starting even when you're in training, the residency and fellowship can be quite demanding as well. A lot of times you're missing a lot of family events that you used to go to, and so that does get stressful. So some of what I do is, of course, always keeping it in perspective, being African American, and of course, growing up, where we grew up down south. One of the things that really helped me in the beginning, and even sometimes even now, is just kind of knowing, what our parents went through. Remember, we used to get all those stories and things of nature of life, their life, and so, when you have to do an extra shift and you compare it to some of the struggles or a lot of the issues that they had to deal with back then, a couple extra hours in the hospital is not quite so bad. It's not good, but it's not quite so bad. It definitely gives you a little bit of perspective there. The other perspective I take is just being glad that I'm not one of the patients in there. Like I said, you're the person that's taking care of them, not the person that's got to be in there. And so those kind of things kind of help out as well. What I have learned to do over time is learning to, kind of step away. I think because I've gone through a number of different jobs, the first time you leave a job, let's go back. So, we have a great work ethic, yet again, coming from home, where we kind of, get a job, you work hard, you just feel like this job can't do anything without you, the whole 9 yards. Mm-hmm. When you leave and you put that notice in and you see how your job changed and you realize that all the love that you have for your job don't have for you. After going through that one or two times, I mean, you learn that job is something separate from you and it's not you. Okay. And that has been a tremendous help so that, now when I'm at work, I take my lunch breaks. I mean, unless somebody is literally dying at the time that I can't do my lunch, I take my lunch breaks. I take my vacations. When it's the weekend and I'm not on call, I take that time to reset myself. Okay. And that has been tremendous. It still every now and then kind of catches up because, like I said, if it gets really busy, like I said, sometimes it takes a while to even decompress. But taking that perspective at least allows you to find the time to find yourself again. And knowing that perspective, like, hey, I need to take time for me because look, if I don't take care of me, I can't take care of the patients. Right. And also, I mean, I've had, situations where I've seen docs that have literally burned out and, just the impact it has on the care that they provide. Like I said, you can't, like I said, once you're burning out, you just don't have capacity for empathy and things of that nature that you need to get your job done. So, after seeing that in someone else, I don't want it in me. And so I've learned to, like I said, every now and then just, take that time off sometimes. And sometimes you, like I said, you literally have to take an extra day and just, sit around and, just relax and let yourself, reset yourself. There you go.
Awesome. So how long have you been a doctor?
So I graduated med school in 2001. And so I graduated from the first residency in 2004 and the fellowship in 2006. So so a doctor since 2001. So okay. So a little bit of time there, a little bit of time about it.
I remember.
I know exactly.
So, as the father of two beautiful young ladies, how do you manage their health holistically? Now, everything now is vitamins and this type of thing that's going on. and everything is buy this and this will give you the nutrients you need. Like, what do you do for your children and for yourself to make sure because you study nephrology and dialysis and all of that, how do you make sure they're well taken care of in terms of their health? And what suggestions do you have for parents during this time to make sure their children's health is good as well?
So I think that when it comes to managing your children's health, of course, having number one, get a good pediatrician. My kids have a pediatrician. I do not try to practice medicine on my kids. If they sick or whatever, we go into the pediatrician.
Right.
So like that, that's one. And don't get me wrong, I sometimes you do, if there are questions or anything about it, I question that. So I do have that, I bring that knowledge in there, but I try to not, I try to go in my pediatric visit as a parent, not as another doctor.
Gotcha.
And so I kind of put myself back into that role. And it kind of takes a little bit of stress off of you. You can ask those, questions that you probably should have known as well, but that kind of helps you out as well. In terms of overall health, try to make sure that, even, with this COVID stuff, me and the youngest child were here, but, trying to make sure that we get out and walk, walk together, make sure we get at least, because if not, they'll sit in front of the phone all day long. So just kind of getting that, get them away from the screen, make sure they get a little exercise. The other thing is make sure they get good nutrition. Because remember, they're going to model whatever you eat or what you bring home.
Right.
So, trying to make sure there's lots of fruits and vegetables available. Like I said, I try to make sure I carve out time that we can cook together. So that kind of, number one, it helps teach them a little bit. It helps you with preparing the meal. And then also it provides them with a healthy meal as well. When we do have to eat out, just because it's too busy, I try to find, honestly, what I try to do is find smaller restaurants instead of chain restaurants where, it's more like individuals cooking, like doing real cooking in the background. So we have there's a Jamaican restaurant that I like up here. And it's Jamaican lady in the back, like a really
right.
So, so I try to do that. Or like if it's an Indian restaurant that's kind of smaller, I like those. So it's more like it's like a home cooked meal. Even though it's an ethnic restaurant, it's still a home cooked meal. Right. So I try to stick to those as opposed to just kind of regular chain stuff that they want all the time. So those are kind of some of the things I do to kind of, maintain their overall health. In terms of stressors, I think, kids for the most part, if you provide, a nice, safe, stable environment, a lot of times they're fairly resilient to everything else. You do talk to them, of course, talk to them about COVID and stuff of the nature, have conversations with them, and just make sure they're not overly stressed, provide for, their basic needs. And those things really kind of go a long way. Of course, me and their mom are not together and things of that nature. So I try to make sure that, I don't put any stresses that we might have onto the kids.
Right.
So keep that above their level, so that they can just kind of have their, their lifetime. And so those are pretty much the biggies. So, from a physical standpoint, like I said, make sure they got a good pediatrician, and follow that advice. Otherwise, for the overall nutritional health, like I said, try to, as much as possible, try to cook some meals yourself, because that just kind of really, like I said, it gives you bonding time together. And then it also provides a nice meal that is healthy, and it provides an example for you. So those are some of the things.
And you and I both have full experience in that, cooking meals together.
Oh, yeah. I wanted to shell some peas. That's what I
wanted. Oh, my God. Shelling peas, cutting pork, we that. Oh, my gosh. Cutting collard peas. Kids don't know nothing about that.
Nothing about that. Like a front porch and a bushel of peas.
Oh my God, they have no idea what that means. I remember
you were fun with all your cousins.
They'll be waiting for me when I got there. Right.
Exactly. Yeah.
I'm a city kid. I don't know nothing about this, but I better learn if I was going to eat.
Right. You want to eat? Do you want to eat?
Right, you want to eat? You better do something. Wow, that's so funny. Well, that's good. That's good. I feel like, the basic thing is like, all right, I'm gonna get my ice cream, donuts, all the things I need. Then it was like, no, let's do some vegetables. And my mom was big on that. And then your dad,
it really was. Yeah.
Just make life better, and you feel better too when you
Oh
eat
yeah,
better,
you know,
as well. And now Xavier, my nephew, like he wants to be in the kitchen and see what my sisters and I are doing, or
yeah,
what Pop is doing. So I'm glad you said that.
yeah.
Thank you.
All right.
So COVID-19 has brought to the surface a lot of fatigue, stress, anxiety, frustration for medical professionals. So those who are on the front line working day in and day out, um, what do you suggest that they do to maintain their well-being? You did say take a day, take a vacation, do all that,
Mhm.
but in some environments they maybe can't step away and take a lunch break.
Yeah.
So outside of home, outside of workplace, what do you think you suggest they do?
Yeah. So COVID-19 is a totally different experience.
Mm-hmm.
And I guess you got a couple of things. I mean, so if we're just talking about the healthcare healthcare providers, I mean, you got two different ones. You got the frontline folks that are out there. You also got a lot of physicians, nurses, stuff of nature that are not frontline and got the stresses of not of in and insecurity of not having their being furloughed or laid off. So you got those folks as well. For the frontline folks, it's a little tough because you have to go in and manage a patient with you know with or possibly with a disease process that is completely new,
Mm. Mm-hmm.
difficult. I mean, like I said, we're learning a little bit more about how it spreads and stuff of that nature. But at that time, I mean, like I said, you know, we're getting information here to just wear a mask. Meanwhile, we look over in China and they're in like these full body suits. And so, of course, you're sitting here trying to figure out, like, okay, so is this enough? What's going on? Can I go through my skin? What's going on here? And so, that initially was I think a lot of cause for anxiety whenever when you going to. I remember going to my first patient that had COVID. I mean, like I said, you have your stuff on there, but you're just wondering, is this enough? You
Wow.
still don't want to breathe. You
Wow.
walk in the room, still don't want to breathe. You got all this stuff on here, you still don't want to breathe.
Right.
Now, I will say that once you've done it a couple of times, and like I said, of course, you don't catch it, then you like I said, you feel that anxiety is a little bit less. For some people, it's going to continue. It's going to continue that way. Um, you know, the rest of it, like I said, and that's for the people that are serving individuals that they know have COVID. Okay, so those one people. Now the rest of us that you know, because one would say, oh, well, the people that are in the COVID units are probably the scariest. Maybe because that person has it, but then the rest of the hospital, anybody could potentially, pop
Mm.
up with it. So it's always that anxiety there. So like I said, so that's another source of anxiety. I think the biggest things are, number one, make sure you wear your personal protective equipment. Kind of follow the rules and things that are set there. If you don't feel like it's enough PPE, like I said, raise that issue. Try to get your own if you can. Just to make sure that you protect yourself, in those environments, and kind of do that. I still say that even though you got to work these long shifts, and it kind of depends. Like, of course, if you're in the ICU part, the more intensive care part, it might be harder than the rest of the floor. But take those breaks, take those small breaks. Sometimes even if it's 10, 15 minutes, go get your snack. Take a deep breath. Kind of let your mind clear. And like I said, don't sit around people talking about the cases and stuff of the nature. Just like say, yeah, just think about if you got your phone, maybe take a look at you've got comics or whatever, something that just kind of
Right.
gets your mind off everything, even if it's like 5 or 10 minutes, so that like I said, when you go back, you can go push the next half of your shift or whatever it is. So yeah, so that's one thing I would say for anyone that's providing care and really in any intensive situation. You have to carve out your time. Maintain your nutrition. The rest thing is kind of hard because, like I said, sometimes you can't get the rest. But like I said, try, as much as possible, try and get your rest. And like I said, and take those small breaks throughout the day in order to get your mind right, get yourself back in that game. So those would probably be the biggest things I would say for any healthcare person that's really in that front line working.
Wow. Thank you. And so, as you know, Brianna's in healthcare.
Yeah.
And so what she's been doing, and when I was home last week, like I was telling somebody else, like she's really intentional about exercising and taking care of herself. And so, she gets up in the morning, um, picks her breakfast, her shake, whatever. And then when she comes home, she's in the basement, exercising, doing things like that. Or she's getting Xavier out to take a walk. So
Mhm.
I agree, those things are definitely important. I know for me, I get the notifications on my phone about the news, but I'm not sitting and watching it all day.
No, turn it off.
I can't, like, it's too much. So I find other things to watch on TV. I do have know other people who are in healthcare, so I check on them.
Okay, good.
So, yeah, I text them and see how they're doing. Um, because it's a lot. It's a lot to deal with.
It
So
is. Yeah.
yeah, cool. So as a nephrologist, as a doctor, you see the body. You see the body and the kidney, and you see hypertension. You see all types of things. But then, how does mental health? How does like stress, anxiety, um, depression, all those different factors? How do they affect your entire body? Because I know for me, when I was diagnosed with high blood pressure, which I was a total shocker, even though it's in my family history, I was like, well, nothing around me I thought would elevate my blood pressure to the point where I needed medication, all the things. But then I realized I was stressed out. Um, my life was transitioning. My mom had just got diagnosed. So then that brought upon what my doctor was saying to me, all these different things bring upon stress. And so that's probably why your blood pressure is higher and then your weight and all these other things. So how does your mental health impact your body?
Well, yeah, kind of like you said. I mean, your mental health is huge, and in terms of affecting your body. Your body literally releases hormones, those fight or flight hormones, and if
Yes.
they exist, and if and for the most part, people, those hormones are there for a reason. Like I said, you're out in the wild and some lion comes by, you run a little faster, a little quicker.
Right.
You're at the gas station, somebody comes to you, you can fight and get away. So yeah, they're good for short periods of time. They're not meant to be there for long periods of time.
Mm-hmm.
And for individuals who are in situations where that stress level is constantly up for long periods of time, yes, it can have negative effects on the body. I don't know, of course, I'm sure if you look at different studies, it'll say varying amounts of how this stress affects you. However, I personally think there's a reason why, like I know some people here, they do work with inner city youth and, find, very high levels of high blood pressure. And so whether that's, I don't know if it's the nutrition, if it's the high stress levels, combination of the two,
Mm-hmm.
acting on each other. But high stress levels over long periods of time are negatively affect your health, kind of in general. So it's always important to like I said, and like I said, depending on where you are, like I said, sometimes it's hard to get out of that particular situation, and that's where kind of learning to either whether it's biofeedback, prayer, meditation, where you kind of take that stress off your shoulders and put it somewhere else while you try to get out of your situation as much as possible. And like I said, sometimes it's tough, but that stuff can help. The meditation and the prayer, literally, it kind of gets it off your mind and onto a third entity. So I think that's where that stuff comes from. And then, like I said, perspective as well. Like I said, just remembering, at least that works for me. Like I said, sometimes it's just remembering that whatever I'm going through, someone else has gone through worse. And sometimes, and that doesn't excuse what I'm going through, but it sometimes makes it a little more manageable. And like I said, that in and of itself can sometimes calm that stress level down. But prolonged stress, can do, and in effect, and the other thing is this, and it affects different people in different ways. So that's the other thing too. So it's definitely important. Like I said, if you're feeling stressed out, trying to find a counselor or something of that nature you can talk to. And that's the other thing too. Like, counseling when it comes to stressors is huge. And I know within our community, the Black community, we look down upon this,
Right.
but it really, like, sitting down, talking to a professional, can be so important in what I call framing your issues.
Okay.
And like I said, it kind of helping you to gather that perspective. And no, it doesn't mean they're going to, and really, it doesn't mean they're going to come up with some sort of diagnosis. You got depression or anxiety or anything of this nature.
Right.
But what it does mean is that you're sitting down, you're getting your things off your chest. And like I said, and when you're talking, like I said, there may be something else that's bothering you. You don't even, it's in your subconscious that you can get off.
Right.
But like I said, if you sit down and talk with that person, it could be huge in helping you address it and helping you shape it and helping you manage it. So I always tell people, like I said, and honestly, I got to point out a lot of my patients, like I said, if they're talking to me and things don't quite sound right, I offer like, hey, you want to go see a counselor about something, and and a lot of times I tell them counselors as opposed to psychiatrists. Usually the counselor can tell them if they need a psychiatrist, but the counselor is just hey, sit down. It's like a professional friend. Sit down, chit chat a little bit. Mm-hmm. Like I said, it may be that, hey, hey, your job sucks. You need to switch jobs. Or it may, or whoever dating sucks. It may be as simple as that. So sometimes it's just a matter of, like I said, they can point those sort of things out to you. But yeah, it's because of the impact that these stressors in your mind have on your body. The use of counselors is enormous. And I always encourage that for a lot of my patients.
Thank you. So thank you so much, Dr. Brown, for your time. But as we close out, I need you to finish this statement. I am resetting my mental health by, how are you resetting your mental health?
So I reset my mental health by, honestly, what I typically will do is, like if I get a weekend, like I did this weekend, I cut my grass because I like to cut the grass. I made some dinner. Okay. And then, maybe I get a good book or like I said, find, something good on Netflix to watch and just kind of what I call veg out a little bit. Okay. And so a lot of times for me, that's all I need to reset myself. And okay. So by the time that weekend goes off, then like I said, I'm ready to go for the next weekend. So that's kind of that's the way I use to reset myself. So
thank you. That sounds like a good idea. I did part of that today, just watching Martin reruns over and over again. That makes me happy. So thank you so much, Dr. Brown, for your time. I hope someone today learned something new, the importance of taking care of our bodies and our minds. And so as we close, as always, be gentle with yourself and others. Never stop believing and be the difference. Until next time, which will be Thursday, which will feel Michael Mills from Delaware, who is a Black male young entrepreneur who will tell us his story about mental health and how he's helping others. So I will talk to you soon, cousin.
Hey, take care.
Thank you so much. Have a good night.
You too. Take care. Bye-bye.